I think we do the basics really, really well. I think there's always room for improvement, and there's a risk that sometimes those conversations can feel a little bit transactional because of the nature of them, and maybe sometimes their importance is downplayed. That's not true across the board, and I think that ties into the fact that there needs to be a more consistent approach with how we have these conversations and really kind of offer value to patients and help with GP workload and burden going forward in the new pharmacy landscape.
The community pharmacy team, they are doing great within the time frame that they have, to do their job. I know that we can do better, and I know that passing on the right message to the patients shouldn't take so long. We have to learn to make every opportunity, every contact count with the patient. So we can improve, we can do better.
I think pharmacy can do better by looking at the consistency of these conversations and really showing that we can have those quality conversations now, especially with the importance of the self-care agenda. Pharmacy will be expected to have more and more of these conversations, and we'll definitely have to show that we can offer value for money as well as value for the patient as well.
I think that we need to invest more in training our staff, and we also need to start using more of the old pharmacy team rather than just the pharmacist doing everything. If we invest in our staff, then it can take the pressure of the pharmacist having to see every patient or give advice to every patient. And also we all have to be antibiotic guardian stewards. I think to achieve best practice, we all need to deliver consistent message. There has to be the same message from the GP, the same message from the pharmacy counter staff, the same message from the technician, from the pharmacy, and we all have to be, conscious of how we need to support our patients. So I think that, there has to be consistency. Either you're multiple or you're independent, wherever you are, so long as you're a healthcare professional, we have to give the right message to the patient.